I believe strongly in the role of the sales professional. I think that stories of the death of the sales rep are greatly exaggerated. The sales rep remains the highest ROI tactic in many instances with many brands. For those doctors and offices that will see a sales rep, that relationship still is the linchpin around which you can build other capabilities, but it really remains foundational. And it's a struggle when you don't have that, or can't build that, or are locked out of that. There are tactics we can talk about there, but I really value the sales professional, and I value them because our physicians and offices value them. There is nothing like when a sales rep goes on vacation as the president of a multi-billion-dollar pharma company, getting a call from a doctor's office saying, "What happened to our rep?" Okay? That tells you that our people are intimately involved in assisting physicians in caring for their patients. Our team actually did an experiment where we were able to build for a brand a suite of interactions, sort of a 360 package of interactions that we wanted to test to see how influential really could they be. And we took doctors who were white space, we call it, had never been called on by one of our sales reps. And these were physicians who were in what we would call for this brand, the lowest tier of advocates, supporters, believers in the brand positioning, et cetera, from their writing behaviors. And over the course of 6 months, by engaging with them through whether it's short peer-to-peer videos on Medscape, WebMD, by direct mail, actual post office mail, which, believe it or not, does get opened, by email, which does get opened, by those types of interactions, we were actually able to convert 18% of those physicians who never saw one of our reps from the bottom tier of belief and writing up to our top tier of advocacy. So that tells me that it can work. It really can work.
All right.
Let me separate it into behaviorally and organizationally. So behaviorally, I have always believed that the best sales professionals actually act as major account managers. They don't do the short sell, just the pushy old style 1990s kind of thing, but actually build a relationship, make advances, do that type of long-term relationship building and value adding over time. So I think just behaviorally, everybody ought to be moving into that kind of a space. Organizationally, we tried something really modeled after the U.S. military in how one approaches a theater. So when you think about like the Iraqi theater, we have an Army and Navy, Air Force, Marines that those departments are responsible for training up, equipping, getting everybody ready. But when you go out into the field, there's actually a theater commander. There's somebody in charge of the ground out there, and they pull all those different strands together, and they know the battle plan, the game plan. Well, we did the same thing and tried that with major systems, major integrated systems in big areas, trying out different styles of integrated systems, because as you know, if you've seen one integrated system, you've seen one integrated system. So we tried different approaches, but the key was having a major account leader there with the sales reps under them, with dedicated medical staffing to be on call and available for appropriate medical interactions, with the payer major account people also part of that team. And I'll tell you, it worked. It really worked. You brought all the brands together. What we found was our people first, the engagement went through the roof. People said this was the job that I wanted 30 years ago when I joined the company. It's that teamwork, it's the patient-focused, it's the customer-focused actions that we all aspire to. Our customers told us the same thing. When you explained to them how we were organizing around them as opposed to our needs, and you sat down with them and would do account planning and say, what do you need from us? Instead of us trying to force ourselves on you, what do you system want from us? You could see a visible physical relaxation from them. It would just depressurize everything. And then we saw that through actual sales results. First, let's start by saying we have a problem, okay? This is not something to put our head in the sand about. Patients are having to pay too much for drugs, okay? Whether they are physician-administered like an oncolytic product with a high list price, or if it's a retail-based product, patients are paying out-of-pocket too much money, okay? What happened? Was there in the last 3 years a radical change in the pricing of drugs, or how either launch prices occur or how drug price increases happen? No. it really didn't, in the last 5 to 7 years, the pricing model really has not changed one bit. Okay, so why did things erupt? They erupted because we have seen a complete and fundamental restructuring of health insurance in the United States over the last 3 to 5 years. More of us now have high deductible plans. More of us now have high cost sharing. Basically, the burden of the cost of insurance, especially out of pocket, has been pushed onto us as employees, or we as individuals in the individual market have gone for low premium plans and have put off that pain of the higher cost sharing at the pharmacy, pretending that's not going to happen. And as a result, when the patient goes into the pharmacy, they're getting the sticker. They're getting the list price. What used to be a tool that was part of the price negotiation, basically, price and rebate negotiation between the pharma company and the insurance company, now the patient's sitting in the middle, standing at the pharmacy and having to pay the bill there, okay? So that's a challenge, and we've got to solve it. It is not sustainable for the patient to walk in and be paying list price for their drugs, thinking that I bought insurance. I paid for this already. Why are you charging me again? Is the attitude. And frankly, if you ask yourselves, I bet you've in buying drugs, you've had your own experiences where you've had that kind of shock. I have. And you all know, you've seen the data that I have seen, the fall-off rates on acquisition and adherence on those meds are just gigantic. And basically, you get beyond 50 to 75 bucks, and your fall-off rates are enormous. So what do we have to do? We've got to work with the insurance industry. My preference would be that this be something the insurance industry and pharma work together to solve, and employers work together to solve, as opposed to the government. But if the government, I guess so be it. How can you pull forward some of the rebates into those high deductible periods so that you may be paying a 50, 60% rebate, the pharma company, but the patient's not getting the benefit of that at the pharmacy? Now, let's be realistic. You do that, premiums go up, okay? So at least some of that rebate money is going to pulling down the premium, or going in the employer's pocket, or going in the insurance company's pocket. But somehow we've got to try to adjust that to solve the issue of high out-of-pocket. I think we ought to be encouraging more funded HSAs. You know, often we think of high deductible plans as being the conservative, the Republican thing. High deductible is not. High deductible with a funded HSA is. I was there when we created it in the Medicare Modernization Act. The idea was not to shove burden onto the patient or the employee. The idea was to create the right incentives for consumption so that I have skin in the game. I'll separate what is said on TV from what's really the image and reputation of the life sciences industry, and just ignore what's said on TV. The biopharmaceutical industry is actually incredibly respected in Washington on both sides of the aisle. Now, sure, are there people who are just detractors who sort of hate at any cost? Yes, but that's not the majority sentiment either among Democrats or Republicans on the Hill, or if there had been a Hillary administration or in a Trump administration. The pharma industry is highly valued. These are some of the best jobs in the United States. It is an economic engine of international trade for the United States. It is an IP, intellectual property repository for the United States. It's the crown jewel. Any country on earth would like to have the biopharmaceutical industry that we have here in the U.S., okay? And policymakers, at least behind closed doors, understand and respect that. They also respect the fact, most of them are learning, we are right now at the beginning of a golden age in pharmaceuticals, really to rival what we saw in past decades. The fruits of the Human Genome Project are increasing understanding the molecular nature of disease, the enhanced number of validated targets as to which we can custom design molecules, especially monoclonal antibodies, to go after, where the question becomes not will it work, but rather does it work without an off-target effect. This is revolutionary. We're seeing this come out of the pipeline right now. We are changing the nature of disease in the world today, and policymakers get that. And they don't. This is why the pricing debate is so dangerous. They sort of want the debate to get solved because they know they don't want to kill this industry, this golden age, right as it is starting now. It is an unbelievably exciting time to be in this industry. It's an even more exciting time to be a patient suffering from one of these debilitating diseases, because you are going to see over the next decade just a change in the expectation of what it means to live with some of the world's most debilitating diseases. And that is what we all got into this business for.